So kind of plugging along here, talked about stress reactivity, and then exercise in the last chapter. So progressing on to anxiety. All right, and I know that sometimes watching these videos can sometimes cause anxiety because of what you're going to be working on and talking about and everything like that. So, all joking aside, you know, there again, just like stress, there's a lot of positives that come from the fact that exercise can have a lasting effect on anxiety in a positive manner. So, let's get down to the nuts and bolts, and then we'll go from there. All right. So when we look at the thinking about kind of things, you ever find yourself in a situation where you felt panicky? Did you how did you deal with that situation? If you thought about it from your own perspective, how would you help somebody who was in a similar situation? So those are all things that we need to kind of come to realization on, is like, oh, I may have to work with somebody at some point here, and trying to talk them off the ledge, not suicide, but you understand what I'm saying with this here. So we have to be able to take any situation, and a panicky situation, stress situation, there's a lack of coping situation, all those things, and how do we deal with each person specifically? Okay, so let's figure it out. All right, so with mental health and mental illness, there's a spectrum of aspects that we can talk about here. And, what is it that we, in terms of mental health, you know, successful performance of mental function resulting in productive activities, fulfilling relationships, and the ability to adapt to change and to cope with adversity. So pretty straightforward. Definitely one of those things that you're able to, with your brain, fulfill lots of different things and be able to produce results no matter what the challenges are that are brought to your attention. All right. Now, mental illness, on the other hand, all right, it's more or less, like it says here, referring to all diagnosable mental disorders. All right. Now, if we broke that down a little bit more, with mental disorders, they're basically health conditions that are characterized by an altered way of thinking, an altered mood state, and pretty much an altered behavior pattern. And that's normally, and it could be all of them combined, it could be each one of them separately, and how they're all associated with, remember we said we can't just use stress, but distress, and basically our impaired functioning of our system. All right. And that, and so here we talk about alterations in thinking, mood, or behavior, with the distress or impaired functioning. And there's that spectrum that I was kind of going along with there. As you can see, mental health problems start to, entail as you get closer to that mental illness component. As you slide down to the right and get closer to that mental health positive side of it to the right, you can see here that, that those mental health problems will dissipate at that point. All right. So when we get down to it, what are we talking about in terms of anxiety? All right. So we talked about so let's talk about the mental health part of it. Well, let's figure out anxiety. All right. So anxiety, like it says here, is a pathological counterpart of normal fear, disturbances, and then disturbances of mood. Okay. And normally with anxiety, we can kind of pull that a little bit more in terms of, and kind of fill in the blanks there. So it's pathological counterpart of normal fear. It manifests by a disturbance of mood, as well as of thinking, behavior, and physiological activities. Okay. So basically you can have anxiety, and then with clinical anxiety, it's resulting in behavior or cognitive changes. So you're no longer thinking in the same manner that you would before, whereas with a bout of anxiety versus clinical anxiety. All right. And then normally with clinical anxiety, it usually occurs with a triggering event. And like it says there, it's disproportionate, and it's disproportionate and unmanageable responses. Okay, so those are the components that you work up with when we talk about anxiety. So what is it more of? I think the next bullet here, the perception and concern over the threat are disproportionate to the actual threat. Basically, you feel that the threat that is out there is actually worse than the threat that is imposed upon you. Someone who gets anxious over thunderstorms, they may feel a certain way about lightning or thunder, when really if they're afraid of thunder, just say we'll go with that anxiety of thunderstorms, but really it's the thunder that gets them. Well, the threat of thunder actually physically hurting them is non-existent, because thunder is just the sound that's produced, in the air. Well, if the thunderstorm caused them anxiety, it's more likely going to be the lightning, because we know that the threat of lightning, especially in Florida, can be worse. So you can see where that certain circumstance, the threat that is perceived is of the thunder sound is really not that great of an actual threat. So therefore, you get anxiety because of that. So it's cognitive and behavioral actions that are undertaken to avoid the symptoms of an anxiety attack. So just another, again, thought and action, thought and behavior action. So, how we're perceiving, with our thoughts, and then what are the behavior, what are we doing? What are the reactions that we're doing? Anxiety can be experienced longer than arousal lasts. So arousal, meaning like when you're in a stress moment, anxiety can be triggered for longer bouts. And then it says even a perceived threat can result in anxiety. So again, it may not even be a real legitimate threat. It could be perceived, and it's just still going to cause that feeling. So when we talk about more into the defining characteristics of anxiety, we're talking about things like specific phobias or fears, social anxiety, or social phobia. There's a separation anxiety. Sometimes that can happen with pregnant women and things like that. PTSD. There's what we call a generalized anxiety disorder. There's your panic disorders or your panic attacks, agoraphobia, and then lastly, obsessive compulsive disorder. Okay, so those are just ways. Those are other aspects that we can look at in terms of what anxiety can be made up of. So, there's a lot of things in here, like panic disorders, that's, panic attacks, panic, you're disordered panicking, separation anxiety, we talked about. Agoraphobia, that's more or less like when you fear, or avoid like certain situations, certain places that may cause you to become panicky, or may cause you a panic attack. So usually people will start to, they start, reacting even before they even get to it, okay, or get to that specific place or location or whatever it may be. All right. So within the U.S., we're talking about approximately 16.4% of the population experiences what we call a diagnosable anxiety disorder. So that's fairly significant, that's a pretty high rate. And then, like it says there, they're consistent with epidemiological surveys. So from studying anxiety, this is what was found, around the world. They're consistent with that number, but in the U.S. is 16.4. And typically, there's a higher prevalence among females and what we would say non-Hispanic whites. Okay, so pretty much the Caucasian population, and then more so in females than males. Okay. So with what we call a symptomology or symptomatology, my fault. Symptomatology. Yes, I hit it on the head. Whew, that was a tongue twister. With symptomatology here, what we're talking about are things like ways that anxiety can fester psychologically and physiologically within our system. So what we're talking about is things like unpleasant feelings, bodily symptoms. Sometimes you'll get things like, not like, blood and stuff like that, but, muscle tension, or you might get what we call autonomic hyperactivity, where you start, where basically spasming, things like that of the muscles themselves. All right. There's changes in cognition. So you might, there might be obsessions or compulsions. It might be some things like fear of certain things. All right, that can come out. So, and usually those fears are more irrational than everything else. There's usually changes in behavior, like with like agoraphobia, you're going to avoid situations or locations. And then what we would call is vigilance, where you're going to now start to look for the danger or a problem. You're going to be a little bit more vigilant, but that's going to cause more anxiety, because if you can't find it, you're still going to start looking for it. And if it's not popping up, you're just like, where is it? Where is it? Where is it? Okay. So with those symptoms, all right, with those symptoms comes, feelings of insecurity, fear, all, stress, and, and then there's obviously anxiety that comes with it. So what are some treatments here? Obviously with medications and psychotherapies that are out there, those are ways that we can do that. But the problem there is, like it says there, it's, oh, okay, there it is. Yeah. With medications, and well, actually psychotherapy itself as well, they are costly. Okay, medication wise, side effects. Some certain psychotherapies may have some side effects too. All right, and then it's time consuming, because it does take some time to adapt and to make changes. So it's not instantaneous. Um, with medications, though, just to kind of throw some stuff out there too, they're usually with anxiety, we'll start using things like tranquilizers and antidepressants. Benzodiazepines are a way. And one of the main benzos that is out there on the market is what we call diazepam. And what it is it's more of a sedative. So it's kind of like, it basically kind of slows things down, and inhibits like our neuro system. All right. The antidepressants, um, there's certain ones that can be used. I'm trying to think of. There's really not any more common ones for that, but I'm sure some of you probably know, just the certain antidepressants that are used. I don't know exact names for them at the moment, but basically making you not have that depressed state that you once had. Usually you're going to have like, serotonin inhibitor, uptake inhibitors, things like that will cause you to not start getting low. Okay. And what they'll do is they'll just reduce the effects, all right, of that. All right. Let's see. So and then also with psychotherapies, they are, like we said, they're lengthy in time. All right, take a while for them to work. They're also very high, and they're a lot more costly than we would even think of. Obviously, medications can obviously weigh heavily as well. Okay. So with physical activity, what we're saying here is that we can potentially look at it from the fact that exercise can be the way to go, in terms of trying to make sure that we can get a better an alternative treatment. All right, a potential tool for both the prevention and the treatment of anxiety. And then, like it says here, there's been a body of literature over the last 45 years or so that has really shown that physical activity can help with those feelings. All right, so if someone's anxious, don't dismiss the ideas of exercise to put them through. All right. So with that, how do we measure? And this kind of went back to how do we measure like stress levels. So like, from the last chapter of chapter 9. So with chapter 10, we're talking about measurements for, for anxiety. So what we're looking at here is both state and trait anxiety. All right. But with state anxiety, like it says there, it's transient. Okay. It's in a transient emotional state. There's usually these senses, so it's always coming and going. There's always these feelings of apprehension. There's what we would call a heightened autonomic nervous system activity. So things like sweaty palms, increased heart rate. Let's see, that going back to the other one we talked about before of muscle tension. All those things can come in that moment. Okay. Whereas with trait anxiety, it's more, you're more general state. All right. There's more apprehension. There's more worry. And there's nervousness. Now that relates to the traits of a person more so than it does the state or the what's going on in the moment. Okay. So those are, that's what we're going to look at in terms of measurement. Well, what are those measures? We can self-report, psychological measurements of self-reporting, and then we have those physiological measurements, like it says here, of things like muscle tension, and how we can determine that is through an EMG, which is an it's electromyography, and that's basically detecting muscular contractions via nervous system impulses. Okay, and it's detecting where those impulses are and how often they are, how sporadic they are, how strong they are. All right. Then there's other things like obviously blood pressure and heart rate. There's the skin response, like we said. Is it cold, clammy skin? Is it sweating? Whatever it may be. And then with the central nervous system and how our brain and spinal cord are, again, acting with our muscles. All right. So those are different ways that we can measure, so that we can see what's going on. So, in terms of state and trait inventory, if we look here, this is actually another really good example of what we can do. I'll blow it up for you. But so what you're going to do is, 1, 2, 3, and 4 scale. And what you're going to say is what's happening, to you right now. Don't worry about what happened 15 minutes ago. What's happening right now? Do you feel calm, tense, at ease, so on and so forth? And so, in that moment, 4 is very much so, 1 is not at all, and where do you fall in between? Okay, and that's really a good way that we can, this is again another way of self-reporting because we can see what this scale is giving us to offer. Okay. So, that's, those are pretty straightforward and easy to measure for someone with anxiety. The EMGs and the EEGs, encephalogical, it's electro in electroencephalography, and that's an EEG, and that's measuring more brain, again, electrical impulse of the brain, where an EMG is getting the data from the muscles themselves. Okay, so we have ways that we can measure all of these things. Well, how do what's the research telling us? All right, with that, with like it says here, preventative effects of exercise. What we're saying is, there's self-reported physical activity. It's, what you're doing with that is you're giving yourself a way to track everything. You're finding ways that you can become better, with your mental health. All right, and by self-reporting, what you're doing is you're going back and looking at everything critically. Okay, and what we're finding though is that with everybody who has a tendency to be more physically active, more physically fit, we find that those people are less anxious than those who are unfit, which again, people who are stressed, going back to last chapter, people that are stressed are those that, typically are unfit because the people that are fit are doing things that, are making them relieve stress more than hold on to it. Not everybody, but you get the idea. All right. So, something to think about here. From observing friends and family members, would you agree that individuals who are physically fit seem to be less anxious than their unfit counterparts? I mean, me personally, from a personal standpoint, I definitely think so. People in my own family and my own friends that I know that just, especially if they're sporadic exercisers too, you can see changes in their demeanor and how they feel about certain things, and that really makes a big difference. So it's really kind of fun, not funny, but it's really kind of interesting, funny to see how like those things are, because it's actually very crazy that, you would think that someone who doesn't work out versus someone who was, that anxiety wouldn't really change much, but it really shows. So, obviously, when we talk about acute and chronic, we have to make sure that we, disseminate the differences here. So making sure that we understand that, acute is in that one moment, whereas chronic is, long term. So it can, obviously we're talking about, typically we want to talk about months, but, weeks to months is pretty common as well. So that's how we have to determine, acute meaning one bout of, when we're talking about exercise, acute exercise is one bout. Chronic exercise is consistent, again, weeks and months, if not longer. All right. So what is the evidence, for in terms of our, like this is our preventative effects? Well, what we're looking at here is, what exercise can play a role in. So with prevention, exercisers have been shown to have lower trait anxiety scores than non-exercisers. Yeah, we talked about that before. Regular physical activity participation has been associated with reduced risk of anxiety disorders, and sedentary behavior is increased with those anxiety symptoms. These are pretty straightforward and pretty straightforward to understand, but also, not too crazy to think that this might be the case. Okay. And if active people become sedentary for a brief time, they can actually have increases in anxiety symptoms. So that is one of those ones that it's just like, whoa, okay, that's something that actually holds a lot of value. So just because you're a very active person, when you become sedentary, it doesn't mean that you're going to stay that way. You actually can increase your anxiety symptoms. Now, it doesn't mean you're going to go, you're going to be a hot mess, but really what we need to think about is that, we'll think about it from your perspective. If you're an avid exerciser and then all of a sudden you go maybe a week or two without training at all, yeah, you start feeling a lot different about certain things and even about your own well-being and how things are going for you. So you have to understand that as well, is that it's there. It's just not on a grand scale like someone who has anxiety symptoms constantly does. All right. So sometimes what happens is we end up having to stay active to keep that risk prevention down, or the risk prevention up, so that we don't get those, anxiety symptoms coming and going. Okay. But again, studies have consistently shown that individuals who are physically fit have less anxiety. So that's pretty much what we're going to sum that up as. And that's pretty straightforward. Again, we've talked about this before and we know that it's out there. So the more physically fit we are, the better mental health wise we are, but obviously with prevention of anxiety as well. So with exercise as a use of treatment, what's the research telling us here? It might be particularly useful in treating clinical conditions, things like PTSD. In our program, in our Health and Human Performance program at our university, we have a lot of veterans that come in and they've had some pretty traumatic experiences that have led them to have PTSD, diagnosed PTSD, not just case study based or just talking about it from themselves that they have it. They find that the more active they are or have been, because they're not in my program anymore, but a lot of them have said that when they exercise during class time, when we have specific labs and stuff like that, they feel way better, and that promotes them to want to work out more, which is really good. But it doesn't make them feel those feelings that they've had previously about certain things. So it's really kind of cool to see how exercise really can make a difference. All right. And then the other thing is that some evidence has shown that, exercise can be just as effective, if not more effective, for those people who are on things like diazepam. All right. So, or a benzo, and it's really kind of crazy that you can think that exercise would have that strong of an effect. All right. But there have been a few studies on clinical samples. And again, if you look what happens when you go from, like it says exercise is either better than or no different from other treatments. But look what happens when you give them exercise versus a drug treatment versus a placebo. Well, we know the placebo is always going to be different, but look at the baseline numbers if we look at this data, and I'll pull it up a little bit bigger so you can see it a little bit more grander. So exercise, having a Hamilton anxiety rating scale score of 20, almost 25, and the drug treatment group having about a 23, 22 at baseline, you can see that they substantially decreased if you go by percentage scale, they're very relatively close. All right. And that's great because that's what we want to see. We want to see that we have these massive changes and that we don't have to rely solely on drugs. All right. That can, obviously have nasty side effects and repercussions if we don't take care of it. All right. So again, exercise as treatment, with research with other types of anxiety has been undertaken as well, like people, like women, that, when we look at women with a diagnosis of GAD, what we're talking about here is that the results suggest that even relatively brief exercise can be useful treatment for individuals suffering from GAD. Now, if we look at everything here in terms of, just so I can pull up a little bit of information for you. Yeah, again, showing that, with very similar to what we saw in individuals, who with PTSD that were on exercise or drug regimens, we again saw changes, that were similar to that, so that we can, basically say that, again, exercise is really showing that, they can actually, lower their feelings, their anxiety scores, so that they can, improve upon what they need to, what's depending upon the situation that they're in. But if we're talking about anxiety, well, then there we go, and it's again pretty clear within the numbers that, and everything that we have seen to that point. So, but exercise and non-clinical anxiety, there's what's the relationship there? Anxiety is reduced following aerobic exercise. That's great. So what we're doing is overall that sense of anxiety within a person is diminished. Okay. There's a reduction in state anxiety following acute exercise. So state anxiety in that moment, in those states of anxious moments, following an acute exercise bout, so a single exercise bout, we're seeing that, surroundings anxiety change. Whereas trait anxiety, you're more behavioral, you're seeing with anxiety is more influenced by the chronic exercise. So that's kind of cool to see and to kind of understand. And then with anaerobic, like sprint based or even weight training, sprint based training, weightlifting training, there's slight increases in state anxiety, which is kind of interesting because you would think that, any type of exercise would have that, but again, one of the things about aerobic exercise is there's a really good endorphin rush that comes with that. So that could be quite a possibility for that. But you would think that, it would drop because of that, because resistance training is a really good reliever of tension and things like that. So it's really kind of interesting that wouldn't be the case. So, some other things to kind of think about is, there's exercise can be result in the reduction of various stress indices. We've already talked about that last class. And then exercise can have a beneficial emotional effect for actually all ages and all genders. So we can see here that, again, it's not just gender specific or age specific. It can be all of that. All right. So one thing to understand, though, is that there is a however to this. Reductions in anxiety are seen following resistance exercise training programs lasting between 2 to 36 weeks. So, again, what are we saying here is that it may be it needs to be more of chronic exercise, chronic resistance training than it needs to be during those acute moments. So that's kind of cool. So really, really interesting that it does take a little bit for that effect to kick in, but once it does, we can see that there's a decrease at that point as well. The thing is, though, is that anxiety reduction does not last indefinitely, but instead returns to pre-exercise levels after some period of time. So it's not a forever thing. So what do we have to do? We have to really try hard and really try to make an effort to keep things moving in a different direction, constantly changing up things that don't cause additional anxiety. So we look at that from a perspective like, okay, well, that's why we never want to have people get stale, because stale in terms of their exercise routines, because if they're anxious, it could come back, and it's like, well, it's not supposed to. It's supposed to be a helper. Okay. So, versus other treatments, exercise has been shown to be better at reducing anxiety than doing nothing else. If you sit around and fester in your thoughts, there you go. You fear things that are not supposed to be fearable or not as fearable. And then also, it's been shown to be as effective as other known anxiety reducing treatments. So exercise is a very strong influencer on, again, anxiety, but also stress too. All right. So really, when if you were to, one of the things you want to think about here is, on this sliding scale, if you were to go over to it and be like, okay, well, where do you feel on the tense or anxious side all the way through to the calm or relaxed side? Where do you perceive yourself in that moment? Now, if you went out and did a 15-minute walk, how would you feel? Well, that's something to think about, because when you come back, you need to realize, like, okay, well, did I kind of loosen up a little bit? Did I get some thoughts out that needed to be, make me a little bit more clear in my head? So what was it really? All right. So there are some concerns though, and they're not like, like for this right here, this is like not one of those things that's going to be like, okay, well, it's going to be a complete waste of time, but what is the dose that we really need? What's the dose that leads to the proper response issue? All right. What's the optimal intensity? What's the optimal duration, frequency? All right. And that's something that we don't know. Okay. So we have to be aware, and we really have to think about it from an individual perspective. Okay. So, is 20 minutes enough for somebody? Is 60 minutes enough? So on and so forth. All right. So but how do we sum this up though, is if we look at it from a consensus standpoint, is exercise can be reduced, it can be associated with a reduced state anxiety. Long-term exercise is associated with reductions in neuroticism and being neurotic, and then trait anxiety. It can cause a reduction of various stress indices, which we talked about. And then, like I said before, it's really beneficial for all ages and genders. All right. And then what are the changes? Well, there's what we call there's a potential thermogenic hypothesis, which happens here when you have a thermogenic, meaning an increase in body temperature. All right. So an elevated body temperature resulting from exercise may lead to observed psychological changes such as reduced anxiety, which is kind of cool. When you heat up, you feel less anxious. Interesting. There's what we call the distraction timeout hypothesis, where exercise kind of makes you take a timeout from your normal routine, and it kind of gives you that relaxative state where, even though you're stressing your body, you're still comfortable in that moment. Also, there's something called the core effect hypothesis. So what you're finding here is that there's, those who have, like a higher anxiety level, or they even have a disordered anxiety, what they'll do is they end up with, physical activity that with physical activity, they just feel more pleasant. Okay. And that's really kind of interesting because it stems from the core, so we look from that pleasantry of the internal. All right. And then lastly, the anxiety symptom interpretation, what they call interoceptive exposure, where it says anxiety reduction through the exposure to such things like exercise, all right, exposure to the somatic sensations, all right, and that, so what you're going to have is you're going to have reduction because exercise is going to provide, somatic sensations. So there's going to be muscle tension, there's going to be elevated heart rate, sweating, and all of those. So you're going to end up with this exposure to certain changes in your certain sensations. So you have that reduction in anxiety. All right. So that's really kind of cool how those are all things that we can kind of put together into one shot. All right. So what do? Well, we want to give them we want to give people regular exercise. All right. And that's going to help, hopefully, we've seen all along with the research and with our explanations that, regular exercise does alleviate anxiety, and it can potentially help it from coming back even in a hustle bustle kind of a life. All right. But it also can be very effective in when we say clinical manifestations, meaning that it's clinical anxiety. So in things like panic disorders, phobias, and then there you go, having that generalized anxiety disorder. So again, keeping it from getting stale and making things more progressive, and making people feel like they're doing something when they're training can help with that anxiety. All right. So chapter 9 was about stress. Chapter 10 more about the anxiety and about anxiety and how it affects us. And then the next thing, when we get for the remainder of this week, we'll get into how depression works and how depression will work with you in terms of the overall feeling, with exercise helping as well. So I appreciate you guys listening to this as always, and I hope this helps moving forward, and if we can help anxious people by giving them some sort of stress outlet or anxiety outlet, to have exercise in their life, then let's do it. So have a great day.